Good afternoon. My name is James Bontempo. Could we get the full screen? Thanks. My name is James Bontempo, and I am the thought leader in information and communication technologies for development at JPIGO. JPIGO is a global health nonprofit that is affiliated with Johns Hopkins University just up the street in Baltimore. For the last 40 years, we've been working to prevent the needless deaths of women in limited resource settings around the world. We're currently working in over 50 countries across several technical areas, but today I'm going to talk specifically about a project in Tanzania that's looking at voluntary medical male circumcision as an HIV prevention strategy and approach, and a text messaging system that we set up to support that, and how we were able to mine and explore some of the data to uncover some interesting trends. Just really quickly, for those of you that aren't aware, 3 separate randomized controlled trials actually showed that being circumcised can lead to up to a 60% reduction in the female to male transmission of HIV. So there's a lot of work going on to scale up, again, voluntary medical male circumcision, especially in countries of high prevalence. Next here. So just really quickly, some background on the project. As I said, we're doing this in Tanzania. Specifically, we're working in the Iringa region, where we are scaling up safe, high-quality MC. We're also initiating MC activities in the Tabora region, and also providing other general technical assistance to other partners and also the government of Tanzania. The project itself began in early 2009, and our first MC services were launched later that year in October. About a year later, when we were launching a campaign in November of 2010, the team decided that they wanted to look for alternative mechanisms for sort of reaching out to potential MC clients and providing them with information and support. So we partnered with an organization called Text to Change. Some of you may be familiar with them. They've done a lot of work in Eastern Africa. And we basically set up a very simple text messaging information service, which had 3 services. There was a toll-free number to which people could text one of 3 words. The first one is tohara, and tohara is a key Swahili word for circumcision. So if they text the word tohara to this number, they get basic information about this link between MC and HIV. They can also text the word wapi, which means where, to get information about where MC services are being provided. And after they actually come in, if they text the word bada to that same toll-free number, they are then followed up with a series of messages, appointment reminders, information about wound care, and other sort of behavior change messages. Just really quickly, I wanted to share with you this poster. So our text messaging service was really part of an integrated kind of behavior change messaging communications strategy. And on this poster in the corner, I'll just draw your attention to that star, which has information about the text messaging service. It basically says, send tohara to this short code 15014 for free to get information about circumcision. So just switching gears really quickly, what I wanted to talk about was how do we take all of this data that is generated as a byproduct of this text messaging service and, again, uncover some interesting trends and information. Now, the term data exhaust, at least the first reference that I'm familiar with, is an Economist article from 2010, basically talking about when you're surfing the internet, surfing the web, every time you click on a link somewhere, that is actually tracked. And those clicks can be used to do interesting things. The example in that article was about how when you do a Google search, depending on which listing you click, that information goes back into improving search results later on. But here we're talking about something slightly different, but it's a similar sort of application. Our data exhaust is actually very, very sort of minimal and simple. It's a phone number. It's the information service that somebody requested. It's the information they got sent back, and it's the date on which, the date and time on which all of that happened. So it's actually not a lot of data, but we were very interested in looking at what can we say using that. So what can we do with that data exhaust? So we can do really simple things like for each of those information services, we can figure out how many requests were made. And in particular, how many unique requests were made, so we can figure out sort of the average usage of a system. So here's tohara, And so 20,000 requests were made to Tohara by 11,000 distinct individuals. So that's, just shy of 2 requests on average per user. So that's interesting, but we can also dive a little bit deeper and we could say, well, how many users make how many requests? So you can see here in this chart, most people just request once or text Tohara once for information. But some people make multiple requests, but this sort of tails off. And in fact, if you look at the data for all of the 3 services, it looks a lot like this. We could also do more interesting things. Because we have their number, we can actually track that individual user across all of the services. So we can start to ask, well, what is the pattern of usage across all of them? So you can see on the left-hand side, most people just ask for information about MC. A good combination, though, ask for information about MC and where it is. And then kind of tailing off other combinations that also include BADA, which is that service afterward. So that's all interesting as well. And this is just analysis we could do simply with the data that we have. But at one point, as we were looking through all of this, we had a bit of an aha moment, and that was we realized that if somebody actually texts the BADA service, that means they've come in to get MC. Because the only way you can actually do that is in post-op, the nurse walks them through that. So BADA wasn't advertised. So that means that somebody actually came in, so we could start to ask ourselves, is there some kind of statistically significant association between asking about information or asking for information about MC or where it's available and actually coming in, actually utilizing services? So our first analysis actually was a little disappointing, perhaps. So we looked at whether Tohara, WAPI, or some combination of them was associated with actual utilization of services or use of BADA. We didn't find statistical significance here or statistically significant association here. But when we just looked at does somebody ask where MC is available or not, we actually did find a statistically significant association then between people who ask where MC is available and actually coming in to use it. And I just put in the observed and in parentheses the expected values to show you kind of where this, where the numbers fall. So fewer than expected people don't text WAPI, don't ask where it is, and come in, and more than expected who text WAPI or ask where it is, come in. So we hypothesize there's something going in there with asking where a service is available and actually coming in to use it. And as we thought about this more, this was a very sort of exploratory process. We thought to ourselves, oh wait, actually our services map quite nicely to sort of your standard pathway model of behavior change. So here is the steps in the trans-theoretical model of behavior change. And so asking what MC is all about is kind of like the contemplation stage, and asking where I can go so I can do something is about preparation. You're getting ready to take action. And then BADA is very consistent with actually having come in and then getting that support immediately afterward. And if we look at the average amount of time between when somebody requests some combination of Tohara or WAPI and when they actually come in, that kind of supports actually that consistency with the behavior change model. If somebody asks where MC is available, on average, 9 days later they'll show up at the facility. If they ask just what it's all about, on average it's 14 days until they show up there. If they go through the whole process, Tohara and WAPI, on average it actually takes 36 days for them to show up in BADA, which means it takes them up 36 days on average to actually come in. So this time analysis here kind of gives some credence to this mapping of the use of these information services and a behavior change model. Now, this isn't perfect. There are several limitations with this kind of approach and with our analysis, and I'm sure you could come up with even more on your own. One challenge is that we don't really know necessarily who's on the other end of that device, right? If somebody texts in the word Tohara, they don't know if it's me or if I'm texting in to show a friend or if I've lent somebody my phone and they're asking for it, etc. When they actually come in and they register for BADA, meaning they've actually come in for MC services, we can't be sure that that Tohara and WAPI that we mapped them to previously was actually them. Again, so there's this whole issue around who is the actual user of the device. We can't necessarily know, at least not the way that our system is designed. from a sort of statistical analysis perspective, you know, the chi-squared analysis isn't the most rigorous analysis approach. It basically shows us that there is a statistically significant association or correlation, but it doesn't say too much about what the nature of that is. Although if we look at those observed versus expected values, we kind of see the direction in which things are going. The time analysis was a little tricky because people actually tend to use the Tohara and WAPI services not just before they come in for MC, but they also appear to be using it afterward. Now that may be because they're texting in to get information to share with their friends or their family or whatever, but people tend to use these services throughout time, not only before but also after coming in. And also the fact that we're oftentimes implementing these services as campaigns where we go out and we try to drive up, you know, demand for services will have, you know, chances are that has some effect on the analysis. So we see sort of peaks in usage at different times that correspond directly to our campaigns. But anyway, so what's the kind of take-home message here? The so what? If you think about kind of our traditional approaches to behavior change communication, radio, television, paper, you know, posters, et cetera, we can't do this kind of analysis as cheaply, as quickly, or as easily as we can with text messaging because that data is just there. It's already there. It's waiting for us to do something with it. It also helps us to have sort of this rapid and iterative approach to research, you know, essentially early and often uncovering interesting or potentially interesting lines of questioning, of inquiry, et cetera. And also it can help to inform the design of these kinds of information services going forward. So just the last sort of parting thought is, you know, if you're going to do this sort of thing, design it in a way that it generates useful data exhaust, and most importantly, do something with it. Thank you very much.